Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. All right, we've got some testicle questions. Question number 1. It's kind of long. I've been experiencing sudden pain in my testicles from time to time over the past few years. The pain is really sudden and only lasts probably like a minute, but it's very severe. I can't move much and have to stay in a certain position. My pediatrician used to do the testicle exam during physicals and never found anything. Since I've switched to a family medicine doctor, she has never done the testicle exam. I myself don't really feel any lumps. Should this be something to be concerned about? So it's tough to say for sure, but I just want to say in general that severe onset of testicle pain is generally an emergency or something to be taken very seriously. So I'm relieved to know that it resolved on its own. It tends to resolve on its own very quickly. So for you in particular, there are a couple things that it might be. So things that cause severe onset of pain would be either torsion of a testicle, so when a testicle twists on itself, or torsion of the appendix testicle, which is a little tiny nubbin, so not like your actual appendix, but it's a little piece of your testicle that hangs off the back side of the testicle. And that can also be twisted and cause some pain too. If that is what's happening, you might actually feel a little bit of like a lump or tenderness on one of the sides of your testicles. If it's actual testicular torsion, you might notice some swelling of the entire testicle. Regardless, it's tough to say for sure which of these is causing your brief bouts of pain. What I would say is try to bring it up with your doctor when you can. You don't necessarily, if you're not having pain at the moment, you could just describe this to that person, to your doctor, and say, I've been experiencing this, I'm really uncomfortable doing the exam right now, but can we talk through what we should do? And they might do a few different things. So they might talk you through sort of the testicular appendix torsion and things that you can do to figure out if it's that versus actual testicle torsion. So they might say, if it resolves on its own very quickly, if you can rest, take some ibuprofen or Tylenol and the pain goes away. That is one option to manage torsion of the testicular appendix. But they also might walk you through another evaluation, which would be getting an ultrasound of your testicles and of the vessels that feed your testicle. And or send you to a urologist, which is a specialist that does stuff with the testicles and penis all the time. So that's a long answer to your long question, but specifically I would say in general, any severe sudden onset of pain in the testicles is generally considered an emergency, but one of them is a true emergency, the testicular torsion, and needs to be acted on like right away. But the other testicular appendix torsion can be a totally benign thing that just happens for the developing testicles and should resolve on its own pretty quickly. So again, you might be having intermittent torsion of your testicle or testicular appendix torsion. Tough to say for sure. Lots of options here, but I would talk to your doctor when you can. All right, question number 2. If you hurt your testicles, does Icy-Hot help? Don't. No. Okay. So I assume you're talking probably about like a blow to the testicles, like if someone knocks you or kicks you or something, or ball to the testicles. Don't put Icy-Hot on them. So Icy-Hot is specifically meant for like muscles and joints. Do not use it on sensitive skin, which includes the genitals, okay? If you do accidentally get some on there, wash it off with a lot of water, okay? Instead, if you do have any damage to, or if you are hit in the testicles and it hurts, just take a breather, give it a few minutes. You can certainly take Tylenol or ibuprofen. You can also briefly apply like a warm pack to the area, but don't put Icy-Hot on your testicles. Don't. It'll hurt. And don't do it. Question number 3. When are you supposed to wear a cup? And can your testicles still get damaged if you're wearing a cup? So you should wear a cup for any sport that there's a risk for direct trauma to your testicles. So that would be, think of like a fast or firm object to the testicles, like a ball or a hockey puck, so like baseball or hockey, or a kick, like with soccer, or a helmet, like with football. Anytime that there is a risk of some either ball or force, firm force hitting your testicles, wear a cup. So realistically, if the cup is fitting well, you are really protected from testicle damage. But it is possible to damage your testicles if the cup does not fit well. And so most cups are designed or sort of sized based on like age or development. And so, so check out different sizes, but for the most part, the way to tell that a cup is fitting appropriately is if it can fit snugly but comfortably against your body. And then you have to hold it in place with a jock strap or support strap. And so make sure that support strap itself also sits comfortably around your waist and around your thighs and doesn't allow for like movement or twisting of the cup. But to answer your question, you should wear a cup with any risk of blunt trauma to your testicles, so any sport with blunt trauma risk. And damage should be minimal if the cup fits properly. Question number 4. What are blue balls? So blue balls, the medical term for blue balls is epididymal hypertension. And it kind of describes what's happening, high blood pressure, in your testicle vessels. So when anyone experiences sexual arousal, there's increased blood flow to the private area. For those with male anatomy, that's increased blood flow to the penis. That's how you get an erection, and to the testicles. With orgasm, blood is then released from the area and flows out. But when someone does not orgasm, the blood sits there, and it takes a while for it to slowly go away. And so the longer that blood sits there, the more pressure it can put on some of the nerves of the testicle. So that extra pressure is what causes some pain or aches in the testicles. Again, when someone does not orgasm with arousal. And so it does get better with time. So if you were to sit, eventually things will get back to normal, or orgasm. And that will also send blood away from the testicles. Question number 5. What are the typical reactions in a male after receiving a kick to the testicles? And what reactions or symptoms indicate that it is serious and he needs urgent evaluation? Okay, so typical reactions, it's going to vary from person to person, but typically it's going to be painful and a little bit sore. So I would expect the pain to be worst within the first 5 minutes or so 5 to 10 minutes, and they can be a little sore thereafter, but you really shouldn't have too much severe pain after about 5 to 10 minutes or so. But if you have severe pain that really does last longer than that amount of time, or if you notice any significant swelling of the testicles, or bruising or blood collection in the testicles, that would be an emergency and you should be seen right away. The other thing that is an emergency is blood in the urine after trauma to the testicles. And so that would indicate potentially either testicle trauma and or penis or urethra trauma too. All right, that'll do it for this round of testicle questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.